Welcome to the press briefing. Today we have three speakers. They are the Controller of the Center for Health Protection, Dr. Edwin Choi, the Head of Communicable Disease Branch of the CHP, Dr. Shang Shukwan, and Chief Manager of the Hospital Authority, Dr. Gladys Guan. We'll first hear from Dr. Chuang. We have 151 PCR positive cases, 31 confirmed by the Hospital Authority, 14 confirmed by Public Health Laboratory Service, 106 by private laboratories. We also have 354 RAT positive cases. So today's positive cases stands at 505 cases. So far we have 1,250,573 cases, 749,703 PCR cases, and 450,865 RAT cases. That includes 34 imported cases. 20 cases of them are PCR cases. 20 PCR cases, 14 RAT cases. There are 11 cases that are picked up at the airport, including 6 arriving on the 31st of May over 4 flights, and 5 cases arriving on the 30th of May over 2 flights. 18 were picked up in the quarantine hotel. They are 3rd day to 7th day samples. There are 5 cases that are 7th day after. There is 1 case is the family member of a confirmed case. That person was confirmed at the hotel and then was sent to an isolation center. That person did not go to into the community. There are also 1 case is the 10th day arriving on the 21st of May from Papua New Guinea. It was an RAT positive case when they left. Perhaps it's an unknown positive case. The other one is a 12-day case. It's a 34 male arriving from Australia on the 16th of May. Before the 22nd of April, he was confirmed, so it's a positive case. The other one is an 11th day case arriving from Korea. 46-year-old male. On the 30th of May, he felt unwell, did an RAT test, and he stayed in the community. It seems to be a local case. There is another case, also 12th day, from someone from Indonesia, asymptomatic. That person also entered the community. It's also RAT positive. It seems to be a local case. All these cases will be sent for full genome sequencing analysis to see if is what we thought. As you see, that today's number of cases is higher compared to yesterday and the day before. We've looked at 505 cases to see what kind of cases they are. For PCR and RAT positive cases, the number both rise, but for RAT cases, the rate of increase is quite marked. Of the RAT cases, we conduct random PCR tests, and we found that a large percentage of people in the past 2 days show a negative RAT result. We don't rule the possibility that there is misleading information or false information supplied. If we think it is a negative, then we will delete the case. Let me remind you that if you knowingly or deliberately supply to the Department of Health misrepresentation or misleading information, under Cap 599 is indictable offense. Penalty is a level 3 penalty and an imprisonment of 6 months. We have also conducted analysis of the 505 cases. 41 of them were picked up during home quarantine. The percentage is the same as previous ones, that is about 10%. There are 22 cases that were picked up on our own initiative, say, for example, from Iron Ferries and Central. The percentage is low. For these cases, they scatter over different districts quite evenly. There is no particularly high number of cases in a particular district, so we don't know whether it's a genuine increase. We do need to observe the situation for a number of days. In care homes, there are no new cases. For schools, there are 39 positive cases, 35 schools. Each school have 1 to 2 cases. Of the 39 cases, there are 24 students from 2 kindergarten, 7 primary schools, and 15 secondary schools, and 15 teaching staff members from 5 kindergarten, 5 primary schools, and 5 secondary schools. There are 37 cases that are RAT positive, 2 PCR positive cases. 21 were confirmed today, 17 were from yesterday, and there is 1 from earlier than that. There are 8 schools with 2 or more cases in the 7 days. There are 2 students that were involved in a basketball team of the Yuen Long Pok Hospital Tang Koo Pui King Memorial College. In one of the grades, there are 2 cases and 8 close contacts. So the school last week suspended the classes of that grade until today. For the other students, they are subject to RAT every day. One of the students turned positive today. Last day of school was 27th. For the other students and 19 teachers that have taught this group of students have been subject to RAT every day. Results are negative. For this school, there is another class with another students not related to the basketball team. So we'll monitor the situation. There are other schools, one with 2 teachers that were confirmed, but they had a meal outside the school. They might be a linked case. For the other 6 schools, the cases does not show any fixed pattern. For the hospital authority, they've reported another death case. So far from them, we have 9,088 cases. In the 5th wave, we have 9,160 cases, including 3,784 female and 5,382 males. For the vaccination analysis is similar to what we said previously. In terms of genome sequencing analysis for BA4, we have another imported case. It's a 5th-day sample from the UK on the 8th of May. For BA4, there are altogether 14 imported cases. BA5, previously we said that there was one who worked at the apron at the airport living in Ma On Shan. Is suspected a BA4 or 5 case. Now is confirmed that is BA.5. We have compared it with known BA5 cases. There are quite a lot of differences. So compared to the cases in other parts of the world in the gene pool, we don't find any similar cases, but it might be similar to cases of other places.
另外咧就係喺
For the McDonald cluster, there has been a family which lives in Li Wing building, and a compulsory testing order was issued. We found 3 more households with confirmed cases, including 2 couples. So 2 couples and 1 household with 1 person who was infected. So altogether 4 households in that building, including, sorry, it's not the McDonald cluster. So this is related to the person who worked in the Hong Kong Convention and Exhibition Center, but that family didn't visit McDonald's. In the 4 households, 3 of them, we could find a bit of vertical transmission. In Central, there are 4 more confirmed cases. So total, we see 30 customers infected in Central, 16 female, 15 male, age ranging from 17 to 30 years old. The genome sequencing is related to the local transmission. For the basketball case, there's 1 case that may be related. That's the student of the same class, but not in the basketball team. As for Iron Fairies, an additional 2 staff members and 15 customers infected. So altogether 49 infected, including 47 customers and 2 staff. "29 female and 20 male, ages from 15 to 58. A member of the staff became unwell on May 28th. He is a waiter, and the other confirmed person is a bartender who is asymptomatic. So they may have been infected there, and I don't think they are the source. There is also a number of people who have not yet complied with the CTN. We are going to continue to track customers who have visited those premises and to follow up whether they have abided by the CTN. Anyone who has not complied with the CTN could be subject to a fine of 10,000 and to receive a compulsory isolation order. And if they do not comply, then they would be fined a level 4 fine of 25,000. So for those who have visited Central Iron Fairies, please go get tested as soon as possible. And now defer to Dr. Kwan. There are now 392 patients in hospital. 42 of them are new cases. Those who need to stay in isolated wards are 73 in isolation wards and 10 in second-tier isolation wards. 34 patients are now in the North Lantau Hospital Hong Kong Infection Control Center. 13 of them are newly confirmed cases. Yesterday, we reported a person with critical condition, but no new additional serious cases. Of those in hospital, there are 10 in critical condition, 8 in serious condition, and 5 of those in critical condition in the ICU. An 88 female patient passed away yesterday. She needed to receive treatment at home and was bedridden. She has not been vaccinated and has chronic diseases include high blood pressure, stroke, and also dementia. And on May 17th, because of a sores in the back, she was admitted to A&E, and she was found positive at hospital with a CT value of 34.3. Her situation deteriorated and she passed away on the morning of May 31st. 64 patients have recovered and 51 of them have been discharged. Since the 5th wave, 50,302 patients have recovered, including 49,937 who have been discharged from hospital. Since the beginning of 2022, there's been a total of 62,682 patients recovered from COVID, with 62,317 discharged from hospital. There has not been any case found or screened at hospital, and so no staff members have been seen as close contacts. And as of today, 23,274 staff members at the HA have been tested positive. 23,233 of them have now returned to work. Now, Dr. Choi will speak. Good afternoon, members of the public. We have heard Dr. Truong's report with 505 cases. So it would seem to be a much higher number from yesterday and the day before, with 329 and 275 respectively. There are many reasons for this surge in cases. We have seen a few clusters, which shows that we need to follow up on the close contacts, and there is a higher risk now in the community. And we have seen transmission chains in the community before. 41 of them have been found positive while being quarantined at home, and we have also contacted 22 through tracing. So we see that there has been a slight increase in the number of PCR tests as well. We hope that members of the public will be vigilant that there is an increase in number of cases and go for vaccination, and also stay healthy and hygienic. We also need to look at hospital figures to see whether there's a need to be worried. And so we've looked at hospital indicators such as those in critical condition and the number of deaths. And we will look at the number of those in ICU and isolation wards. And we see that the trend is still steady at this moment. We will continue to monitor the situation. Even though there is a surge in cases, we have to ensure that there is not a huge impact on hospital indicators. Another observation was mentioned by Dr. Truong. Out of the 505 cases today, 354 of them were tested positive through RAT. So that's 70% of all cases. And so this is a higher number than before. So for each RAT, we would review the case to also see whether the PCR test is positive. We have seen a higher percentage for those who are tested positive RAD yet negative in PCR tests. So that's an increase of 30%. So that's actually 7% higher than before. So I have to remind members of the public that you must report a positive case within 24 hours. Otherwise, we would see from PCR tests that you will be tested negative. So be aware that we are going to review the case. I suspect that with the third phase of vaccine pass being implemented in May 31st, some people have been using old data and information. I know that people have been inquiring about this topic, and I would like you to take heed and also to remind others. The question we hear most is that in the past they've already taken 2 vaccines, but then they were tested positive between February or March through RAT, but then they did not report the cases. Therefore, now by May 31st, when the third phase of vaccine pass becomes effective, then they have queries on how they should handle it. Should they go for vaccination, or should they actually try to go to see whether those cases were really positive in the past 3 months?
Well, now Don't get bogged down by trying to get a recovery record back in February or March. If you have been vaccinated with 2 doses, that means you are not resistant towards vaccination. There was a discussion in the Joint Scientific Committee. If you've been vaccinated 2 times, even with an infection, it is rather safe for you to receive the 3rd dose. Looking at the inquiries, very often, if those have been tested positive back in February and March, to this day, it's been over a month. So if you don't know what to do, the best way is to get vaccinated so you can complete the 3rd dose to give yourself the protection and also meet the requirements under the vaccine pass. So this is an alternative you may consider. Please do not provide false information just to get a recovery record. As Dr. Chuang said, deliberate provision of false information carries a criminal liability. If for the information you've submitted, we are able to verify it. So if you've been vaccinated twice, and if you don't have a recovery record, as long as it's been over 1 month since you have been tested positive, it's still safe for you to be vaccinated. For those who have not yet been vaccinated at all, please get vaccinated. Now the floor is open for questions. Introduce your media outlet before you ask your questions. Good afternoon. I'm from Now TV. I'd like to ask about the 500 cases reported. So what's the risk of a rebound, high or low? For RAT, today we heard from Professor Hong that after every RAT, there should be a PCR test to make sure that it is positive before you announce it as a positive case. Would you consider that? Today, you said that about the RAT, there may be misleading information or false report. Would it have affected the previous epidemic situation? Would the numbers been inflected? For Li Wing building, there is a chance of a vertical transmission. Do you consider that it is necessary for evacuation? What's the risk of an outbreak at that building? For the bars cluster, we see that at Iron Ferries, there are 2 staff members that have been tested positive. Have they been to different bars? Is it the case that they have caused the cases in other bars? Let me answer one of the questions. I'll defer to Dr. Chong about epidemic situation. In relation to every RAT, we will follow up with a PCR test so we are alive to the actual number. Starting from end of February with the reporting platform in place, we try to give you as much information as possible to be transparent. There are cases when it's found to be negative in the end, the case was deleted, but it doesn't have a huge impact on the trend. That's why a number of experts and professors saying that the focus on looking at the number of cases to gauge the trend is only one of the factors. You also have to look at the number of people in ICU, number of admissions, etc. We see that today we have 505 cases. You see there is a change in the trend, but we don't rule out the possibility that after verification, some cases may be negative and then they will be excluded. Well, as to whether if we decide not to report certain numbers, say for example RAT cases, then you might find that there will be some parts missing. So there may be some adjustments in the end. For Li Wing building, we think that is because of the CTN and that there are people with symptoms. That's why these cases are found. For vertical transmission, it's not alone in this building. In the 5th wave, we found the same thing in other buildings, especially those under RTD and CTNs. For this building, there are 4 units involved. It may be BA.2.1, 2.1, so there is a chance that it is a vertical transmission. We've sent all the cases to CIF, that is to community isolation facilities. Close contacts have been sent for quarantine. For Iron Ferries, the 2 staff members, one is asymptomatic. The other one shows symptoms rather at a late stage. They don't seem to be the source, but for every case, there is a chance of transmission. It's not limited to staff members. We see that there are customers who've been to these 2 places and other places as well. So far, we have not identified any transmission at other places. The one at the far side, at the back in white. I'm from Hong Kong 01. First, for the 2 bars, are these 2 outbreaks linked? Because they are quite close in proximity. Perhaps customers might be to these 2 places and have contact. In relation to the Tang Pui King Memorial College and the students, what about the whereabouts? Anything related to Central? What's the class number? What's the age? After being to Central, has that person been to other places? So can you give us more details about his whereabouts? Is it confirmed that it's not linked to the outbreak at the school? I want to ask about Hong Kong CEC. Apart from the cases mentioned yesterday, for the other cases, is it related to BA.2.12.1? I'll defer to Dr. Chong about the bars and the student. I need to look at the full genome sequencing analysis to see if they are similar. For both bars, they are related to local prevalent strain. So far, epidemiologically, we've only identified these 2 cases. Of course, we can look further at the full genome sequencing analysis to see how much difference there is. For the Memorial College, we previously mentioned that there is a customer from Central who taught at the basketball team. There are 8 students at that college that have been confirmed. These 8 students are over different classrooms. In one, there are 2 students and there are 8 close contacts because they all play basketball. So for that class, because it involves quite a number of students and the others have been sent to quarantine. So for that class has been suspended till today. For one student who've been absent from school, he's tested positive today. It may be the case that he's had contact with the other 2 cases, although he did not play basketball. It might be a linked case. For the cases at Hong Kong CEC, they are for known cases, we've conducted analysis. They are similar to BA.2.12.1 and almost the same as those cases at McDonald's. The lady at the front.
I'm from Bloomberg News. My question is about the cluster at the DSC International School of Canada. We've heard that for the students and the close contacts of these confirmed cases, they've been taken to centralized quarantine, for example, Penny's Bay and Sai Kung facility, to go through quarantine when they've specifically requested home quarantine. So they've said that they've been forced to go to centralized quarantine. So has there been a change in the home quarantine policy? Or is this because of the new subvariant being involved, which is the BA.2.12.1? And if this is a backpedal from the existing policy, does this apply to all other confirmed cases? Or is this only involving the schools? So has the confirmed cases of the McDonald's cluster as well as the exhibition center cluster, are they also being sent to centralized quarantine? And lastly, can you give an updated number of all of the community BA.2, .12.1 cases that have been detected? Thank you.
Okay, thanks for your questions. So I will let you know our current ways of investigation and also the quarantine measures, and maybe Dr. Zhang can elaborate the details if needed. Okay, so the objective, the aim to quarantine or isolate is to contain the disease and to reduce the spread of disease in community. So for those, we receive their questionnaires about the home condition. Will assess whether the case is suitable for home isolation or we need to isolate in a controlled environment, and so as for the quarantined venues. But we are now quite concerned about the new variant sublineage. So at present, the predominant strain is Omicron BA.2.2, as you know, which is circulating in Hong Kong since January this year, replacing the earlier BA.1 and also the Delta strain. So it is quite important for us to closely monitor the circulating strain in Hong Kong, in particular those imported cases which we detected in the airport or the designated quarantine hotel for arrivals. As of today, there are several Omicron sublineage that we want to focus to investigate more, like the BA.2.12.1, BA.4, BA.5, which has emerged in overseas widely. So the latest information show that this Omicron sublineage may have higher transmissibility and also more immune escape compared to those predominantly prevailing BA.2.2. So we have to take a more stringent approach to deal with this kind of new Omicron sublineage. So in case, if we handle a case suspected to have infected with this Omicron sublineage like BA.2, .12.1, we have to take them to the control facilities, like the community isolation facilities or hospital if there are any symptoms, and their close contact will be put to the quarantine centers for a more closely observation of this case. So this is in particular for those new Omicron sublineage strain. Yeah. Okay, so John, please.
So far we have around 34 suspected or confirmed BA.2.1 cases, and all cases we have been sending them to the community isolation facilities or hospital. Community isolation facilities or quarantine centers. At the moment it is.
Yes.
Next question, please. The gentleman here. Good afternoon from TVB. I'll also like to ask about the number of positive cases today. A doctor said there are 354 RAT confirmed cases. So out of these 354 cases, when did they report the cases? How many of them reported positive during February and March? So if you take these numbers out, can you find which cluster they come from? Are they identified through compulsory testing on specified premises? And yesterday, you issued CTN for the 2 bars. So how many people still have not yet complied with the CTN order? Thank you for your question. Dr. Chuang will tell you about the figures of the cluster. But back to the question of the RAT. For you to be able to submit a positive case, on our platform. So the test must be done on May 31st or May 30th, because you cannot report any cases before May 30th. So these 354 cases should all have been tested positive on May 30th and May 31st. I will defer to Dr. Trung to answer questions on address and whether they were found under compulsory testing. When we test them with a PCR test and find them negative, then we will need to follow up and investigate the case, because we do see fake positive cases in RAT. So in the past, we see about 1 to 2%, but now this time the number is 7%. We see similar figures in hospital. So if you tested positive on RAT, yet you're found positive at a PCR, then that's a limitation of the RAT itself. We understand this limitation. However, when the percentage in fake positive is higher than usual, then we would need to investigate whether it is misleading or false information, because that person might not have been tested positive on that day. In recent days, we have seen a higher percentage in fake negative cases. So I remind members of the public not to submit a positive report on our platform if you're not tested positive that day. If you just want to comply with the social distancing measures and the vaccine plus, and just go jabbed the third time, then you will be all right. Well, out of the 505 positive cases today, we would analyze information on where they reside. 41 cases are linked to confirmed family members, and 22 are new cases which might be linked to our clusters. But as for other cases, we do not yet see a cluster or outbreak yet. Out of the 18 districts, we see cases in every district. And if we use a percentage of a population of 10,000 in Central and Western District, so we do see a higher percentage, 3.26. So out of every 10,000 people, you see 3.26 infected persons. So it should be around 10 out of every 10,000, 1.5 to 3.26 persons in Central and Western districts is 3.26, which is the highest number. In Xinhuan is 2.18. Taipo is also 2.81. And for the other districts, it's between 1 and 2 point something. So we do not see a higher number of confirmed cases in any district. I will supplement some information in other indicators, including sewage, and surveillance or point prevalence. We see a steady number, a steady trend, but we know that there are transmission chains in the community. So of course there would be a fluctuation in numbers. Well, are we going to reach a high 300 or a low 400 figure? We do not know that. But then with any cluster, well, we are sure to see an outbreak.
我自己就
I don't have the actual figure, but I know that quite a number of people are not tested. They're not on our record. So we have sent a warning message. We use a telephone number. If they don't pick up the phone, we'll have to find other ways to reach them. It will take time. Next. The lady at the back. I'm from Mingpao. First, I'd like to check the number at Liwing Building. 4 units, 8 people. Is that right? And for the 8 cases, what about the flaws and also the distribution of the direction they face. For RAT reporting platform, you've talked about the percentage of verification. Can you talk about the actual number of cases that are suspected to be false reports? For the BA.5 case at the airport apron, you suspect that there is a silent transmission of another sublineage. What is the likely source? In Hong Kong, how many cases are BA.2.12.1? Dr. Chong talked about 34 cases suspected to be of this variant. What clusters are they? Taikoo Shing, were any investigation or update about the Taikoo Shing cluster? For Lee Wing building, there are 4 units. The first one is one that we have known. Someone who worked at Hong Kong CEC as a cleaner, a family of 3 for the other 2 units. So 4 people, 2 in each household, and there is another case in a flat facing a different direction. So at this building, Lee Wing building, 8 cases. If you count these cases as well, there are 35 cases. If you're talking about suspected BA.2.12.1, most of these cases, about 24 of them, are related to the McDonald's at Taikoo Shing. They are customers. I have not counted the 2 new cases from Lang Kwai Fong. For Richland Gardens, there are some cases who live there, and they've related to one of the cases, that is, they've been to McDonald's. For the DSE International School, there are students living in the building in Taikoo Shing Chou Yu Toi. There are 8 students. There are also some other cases. They seem to be linked. Say for Hong Kong CEC, there are 3 people who work there, plus 1 more who lives in Lee Wing building. There are also other cases that we have not found a link yet. There is one who lives in Sha Tin but works in the immigration department. There is one who lives in Mountain Terrace of Taikoo Shing. They are suspected or confirmed BA.2.12.1 case. You talk about RAT. For each case after the PCR test, if there is any discrepancies from the case reported, we will carry out investigation. I've shared with you some information, say, for example, a photo that doesn't show clear 2 lines. We may accept the explanation that it's not deliberate. I remember there are at least 2 cases that have reached the law enforcement stage because we have evidence to show that they have provided false information. So whenever we find discrepancies, we will carry out investigation, but it doesn't mean that all cases tested in the end negative are false information cases, because there is always a chance of a false positive. There are about 7% of them that are related to the device. And if there's any irregularities, then we will be alerted to other factors. Sorry, speakers off mic. We have not yet found the source of transmission because the work doesn't involve people from outside. The apron itself may be a high-risk location. But the genome sequencing analysis doesn't show any relation with existing BA.5 cases. Last 2 questions. I'm from cable TV. I'd like to ask about Tang Pui King Memorial College. So which class have seen their class suspended? 2 or 3 students. Should the suspension be extended? Are you concerned that if there is class resumption, then there may be further transmission? For the 2 imported cases, They said that they have entered the community and there is a chance that they are local infection. Can you tell us about their whereabouts? For Tang Pui King Memorial School, there are 8 students from the basketball team. They were confirmed case, and it's linked to Central because the basketball coach have been there. For the basketball team, all of them are under home isolation. In one of the classes, there are 2 students that have been confirmed, and there are 8 close contacts. So for that class, suspension started on this 27th until today. That has been sufficient time, and they have to do RAT every day. For one of the students in that class, RAT is positive. The student did not go to school. So every day students are subject to RAT. We think the transmission risk is not high. Well, that students have resumed classes. I'm sure that they are aware of that. Sorry, speakers of mic. Imported cases. They have been to other places. It's not the case that they are cooped up at home, so there is a chance of infection in the community. There is not much significance. Last question. I'm from AM 7:30. At the beginning, you talk about verification of RAT cases that are negative. For the 18 to 30%, when is that figure related to? When did you change your policy from random check to full check? For the 354 cases, have you done your verification? You mentioned that it might be because of the vaccine pass, they make the report now. Or will you carry on investigation to find out if there are other reasons why there is a spike in number of cases? For the bars in Central, there are still quite a number of people who have not been tested. How many? Hundreds or 200? In the CTN, is during the random check at Hoi Taiwan Bun said that there are several people who've not done their test. Well, are there any actions taken, or they have to pay the $10,000 fine? That's in relation to Seaview Crescent. And the apron, what's the exact location at the apron? Their colleagues, do they come into contact with arrivals? I'll answer some of the questions first. In relation to the reporting system of RAT, at the beginning we conducted a random checks. Every day we will do random checks to see what is the percentage of false positive cases. When the number of cases is low, we have the resources to do the checking, and we will send someone to give them a sample file to ask them for sample to be provided. So we will conduct the PCR test. I mentioned 10 to 30%. We ask a contractor to identify these cases. So we're talking about 10 to 30% of the cases. That's the figure in the past few days. And we found that the figure is higher than what we knew, that is 7%.
個案呢，
For yesterday's cases, they have just been reported, and so we have not yet reviewed them. We are going to send them a sample for them to be submitted back. I'm not going to explore the reasons behind it. I just want to say that we have been asked the same question many times these 2 weeks. I'm sure due to the vaccine pass requirements, some of them worry about whether they could receive a recovery QR code for being positive 3 months ago. Actually, the best solution is to get vaccinated. I just want to reiterate that it's safe to be vaccinated after 1 month of being tested positive. Dr. Chuang, the person who works at the airport apron, we have compared the variants. For the McDonald cluster, the genome sequencing should be exactly the same. So there's a 0 SMP difference. But for the person who works at the airport apron, the genome sequencing actually shows a 10 SMP difference compared with our local cases and compared with overseas, we see that there's also a 10 SMP difference for South Africa, Scotland, UK, Denmark, and US, Australia. We see also those with similar genome sequencing. So it's really hard to tell a difference here. But currently, we do not have further information on his colleagues because they mainly work at the airport and they have to take RAT and PCR testing on a regular basis. You ask about how many people still have not complied with the CTN order. The number is over 100 yesterday, and today it's still around 100. This is the end of the PB.